Well, hello, historian. Good evening. I'm Rayhan, and welcome to tonight's special report. Across the nation, college campuses are grappling with a mental health crisis that is reaching unprecedented levels. Students, faculty, and staff are all sounding the alarm as anxiety, depression, and even suicidal ideation hit record highs. A new national survey reveals that more than 60% of college students now meet the criteria for at least one mental health issue, a staggering 50% increase since 2013. Of the 90,000 students surveyed across 133 U.S. campuses, 44% reported symptoms of depression, 37% experienced anxiety, and 15% admitted to contemplating suicide. And these are the highest rates ever recorded. Faculty members like Jim Perez of Olive Harvey College in Chicago witnessed the fallout firsthand. One student recently confided to him, "I can't even get out of bed today," while another shared the heartbreaking news of losing a family member in a triple homicide. And for educators, these moments underline the growing challenge. Many students simply aren't receiving the help they desperately need. Access to mental health services remains deeply inequitable. Studies show that while nearly half of white college students seek treatment, only about 25% of Black and Asian students do the same. And one of the major reasons is a lack of diversity among counselors. While nearly half of the U.S. college students are non-white, 72% of college counselors are white. This disparity, coupled with stigma and understaffed wellness centers, leaves students, particularly those of color, without the support they need. Even faculty are feeling the strain. Most adjunct professors work multiple jobs to make ends meet, leaving them spread thin and unable to provide the level of care students often require. And campus counseling centers, already overwhelmed before COVID-19, now face burnout and high turnover among staff. And the mental health crisis is also impacting academic success. A recent Gallup and Lumina Foundation study found that 4 in 10 college students have considered withdrawing from school due to emotional stress. And for many, balancing coursework, jobs, and caregiving responsibilities become unbearable. As one professor noted, when students fall behind, it's essential to help them prioritize and rebuild confidence step by step. And advocates, including the National Education Association or the NEA, are calling on universities to act. Their demands include hiring more diverse mental health professionals, training faculty to respond with cultural competency, and creating inclusive policies to support students in need. And the message is clear. Our higher education system must invest in the mental well-being of its students and staff. Anything less risks